A cancer cell takes in far more glucose than a normal cell.
The oncologist told me it's too late. We have nothing to do for you. You already dead. I find the solution, autophagy, and who spoke about autophagy? Of course, the Nobel Prize 2016.
You do have that chance, at least in these 18 people, to double your survival. What is the same thing about all cancers? And that it really comes down to the mitochondrial dysfunction or damage. So I think the two most approachable things people can do are.
In this episode, I had the opportunity to talk with Derek Lee, who's a researcher from the Seyfried lab located in Boston College, which focuses mainly on the metabolic treatment for chronic diseases, just like cancer. So this is not basic information that mainstream media gives you. And if you're liking those free videos, the podcasts, the podcuts, please subscribe to the channel. This is very important for you to be getting the videos, getting the information, which is pretty valuable. So let's go to the podcast. I've also seen plenty of studies within PMC talking about hyperbaric oxygen therapy. So what is the mechanism of hyperbaric oxygen therapy, and how does it help to treat cancer?
Yeah, hyperbaric is very interesting, and I think it's been gaining a lot of traction. So to try and keep it big picture, like I said, in a cancer cell with this very inefficient energy metabolism, a byproduct of very inefficient energy metabolism is the creation of reactive oxygen species. Uh, and these accumulate inside a cancer cell. Now, normally in a normal cell, this might be enough to kill it, but of course, cancer evades these apoptosis signals and everything. So there's a very high amount of ROS in a cancer cell. What hyperbaric oxygen tries to do is it tries to exploit that high amount of ROS in a cancer cell and essentially turn them into weapons against the tumor cell. So by going in a very high concentration or at least high pressure of oxygen, it can help kind of, for lack of a more sophisticated word, detonate those ROS, those reactive oxygen species, and try and kill the cancer that way. So again, it's another way, it's another mechanism of trying to take advantage of the altered metabolism in a cancer cell.
Makes sense. And what does that have to deal with performance? I've seen Dr. D'Agostino talking on his TEDx that it was before it was used as cancer treatment. It was also used for, I believe, Navy SEALs or people in the army for it to be done. Why was it used for that? What does it have within performance within the metabolism?
So that is outside of my field, but I will say that one of the limiting factors to especially endurance exercise is how much oxygen can you deliver to your muscles before they have to switch to anaerobic metabolism. So I'm sure this is also another reason people train at low altitude, right? They're trying to get their body more efficient at transporting oxygen across their body. Now it's the opposite way for people who train in the mountains or something, but I think it's the same principle. It's trying to deliver more oxygen to your muscles so that they can go longer before switching over to anaerobic metabolism, which is very powerful. But in your muscles, you can only do for so long, right? Think of it as sprinting, type of metabolism you would use when you're trying to sprint. So, like I said, outside of my field, but I believe it's trying to uh, shuttle more oxygen towards the muscles.
Mhm. Also about ketogenic diet. So I've seen a study they did recently within triathletes, and they were switching off triathletes within keto diets and glucose rich diets. So high carbohydrate diet um against ketogenic diet. So they were comparing about their performance, and it was pretty much like ketogenic was slightly higher um than high carb athletes. I mean, they waited a little bit because when you switch to ketogenic metabolic therapy, you got to have that status that your body adapts within tapping fat, especially and using more ketone bodies, producing more ketone bodies. And it's pretty interesting how ketogenic diets can increase your uptake of oxygen itself, and I would say also maintain your metabolism more efficient, I would say. I just feel really bad uh that's not really considered within today because of the standard guidelines.
Yeah, I think the athletics is a very interesting case example, right? I think most people would say, you always hear about carb loading before races and stuff like this. And of course, there's ultra marathoners who do that, perform at an extremely high level. But there's also ultra marathoners who have done it on a ketogenic diet. So if you're trying to rationalize how that is, if we're saying that you need this so much sugar and all these carbohydrate reserves the night before a race, if this guy is intentionally depleting himself of that, how can these athletes perform at the same, if not slightly higher, like you said,
Mhm.
level than someone who has all this glucose in their body? And this kind of goes down to the kind of the beauty of ketones. They're actually on a mole to mole, so a gram to gram basis. Ketones are actually a slightly more efficient energy source than that of glucose or pyruvate, which is part of the
Mhm.
glucose breakdown pathway. The reason for that is very deep into biochemistry and has to do with how ketone bodies are used in the electron transport chain, which is part of the mitochondria and all of this. But at least I can give you a specific example of in a heart cell. A lot of this work was done by Richard Veech, who used to work at the NIH before he passed, unfortunately. He took ketone bodies and gave them to a heart. And he found that when you gave ketone bodies, it improved the output and performance of a heart in cell culture by 26 or 28%. So they're very powerful molecules, and I think that's why these ultra marathoners or even some strength athletes, though not as many, of course, they can compete with these glucose rich athletes um, because it is a more efficient fuel at the end of the day. So it is a really interesting field, and I love that a lot of people are doing it. Like I know Jeff Volek out of Ohio State.
Mhm.
I believe he's at Ohio State. He does a lot of work with this as well,
Mhm.
and I think it just goes to show you how adaptable the body is, how adaptable normal healthy cells are, and how we can utilize different nutrients for survival. This goes back to the cancer issue, right? Because one of the criticisms we hear is that, well, if you're not allowing, or if you're not telling people to eat glucose, they're going to feel horrible and they're going to have no energy. Whereas if you actually talk to people who are doing this, they actually report the opposite. They report feeling great in some circumstances, right? There can be, some bloating and things if you're not used to the diet. But once you adjust to the diet, people actually feel very stable levels because you're not having these huge glucose spikes up and down throughout the day. Think about the stereotypical post-lunch crash because you
Mhm.
had all this food at lunch and then your sugar crashes and you
Mhm.
feel awful. If you're doing it on a ketogenic diet, you don't have that. The ketone bodies in your blood are relatively stable, much more stable than glucose for sure. And people report feeling great once they've adapted and adjusted to the diet. So yeah, I think it's a great example of practice versus theory. Whereas in practice, these people do feel great. And like you said, I think this should be studied way more.
I agree. There's like an anecdotal evidence from an athlete that he's a carnivore athlete, and he's called Medeiros. He's from Brazil, and he said that he switched from high carb to carnivore diet. I think 5 years ago. I can be wrong, and he said that his performance itself was much better. But obviously, at the start, a lot of people say they feel the keto flu, as we say a lot, because your body is adapting within the ketogenic state to not eat carbohydrates and rather using ketone bodies as fuel. But within that change, you feel weaker, you feel a little weird, and that's because your body is probably adapted to use glucose and more than it should. And
Yeah, I,
mhm,
I, I totally agree. And if I can just say, like, I think people report this keto flu issue, and it's very real. Don't get me wrong, but I mean, if you think about it logically, we've been eating excess carbohydrates for 20, 30, 40 years, however old you are. If one day you just suddenly tell your body no more, it's going to take a few days for your body to adjust.
Mhm.
And I think because so many people are doing it, there are a lot of resources to tell you how to try and get over that flu and get over to the other side, the side where you're feeling a lot better. I think hydration, people don't realize that you have to hydrate a little bit more once you switch off carbohydrates because carbohydrates move water in your body. People don't realize that as much. As long as you keep your hydration and your electrolytes up, I think that helps with the keto flu a lot. But of course, if you're just trying it for the first time, you might not know things like that. But I think as more and more people talk about it and more clinical cases come out about it, I think that'll become more known. And I think the issues of adherence and keto flu and some of these other symptoms will go down for sure.
Mhm.
Well, it's not that it kills the bad bacteria, it's indiscriminate. It kills all the bacteria in the mouth. And take the gut microbiome for a while. We know better now. We don't want to kill all the bugs in the gut. That would be an antibiotic, for example.